So my journey now with my new doctor began a few weeks later where we had to go up and meet with the doctor, a whole team of doctors in Wisconsin and Madison. He went over my CT scan with me and explained what was going to happen. I met with the ENT oncologist. I met with the radiologist. And then I met with my nurse liaison, that she's kind of the contact person for if I had any questions, to help coordinate appointments. We had a surgery date scheduled for December 3rd. I had to go through a bunch of blood tests and everything before I had the surgery. But we went December 3rd, had to be there in Madison at like 6:30 in the morning to check in. And they got us right in because I was going to be the first patient of the day for surgery. It was going to be an 8-hour surgery, ended up being longer. But they were going to remove 2/3 of my tongue, my bottom teeth, some of my floor of my mouth, part of my jaw, and then 43 lymph nodes from my neck. I was terrified, not gonna lie. It was very overwhelming. I tried to be brave as I could. But I also knew that it was probably going to be harder on my husband because I was going to be asleep. I was going to know. He was going to have to be the one to sit and wait and wait and wait. So they took me back into the surgery room. Everybody that was in the room who was going to take part in the surgery came over and introduced themselves and what their role was going to be. To be honest with you, I didn't care. I just wanted to get the anesthesia and go to sleep. My anxiety was so high. Finally, they put me to sleep. I woke up and I had a tracheotomy. I had wires and tubes everywhere. I had a feeding tube. I had 3 drains. I had 2 coming out of my neck, 1 coming out of my leg. I had an incision in my left leg that went from my hip down to my knee that they took tissue to rebuild my new tongue. My tongue was so swollen I couldn't talk. I was drooling all over myself. And I had all sorts of doctors and nurses, and I just wanted to see my husband. So they got me into my regular room, got me all hooked up to all the monitors. My husband came in, and I knew my life was going to be so different. I didn't realize just how much of my tongue they were going to take. I didn't realize how much I used my tongue to talk because I couldn't talk. I had to use a dry erase board to communicate. I felt devastated, to be honest with you, because I didn't think I was ever going to be able to talk again or eat normal or getting fed through a tube. I couldn't even look at my mouth to see what my tongue looked like. Because in my head I could feel it, kind of. I can't feel anything in my mouth, but in my head I could. And then I realized I had to suck it up. I had to, this is what it is, and we're gonna do what we can. Um, so, every day we was a little bit better and made a little bit progress every day. Got up and started walking. They wouldn't let me have anything to drink. I was so thirsty. So about the third day, they let me have some ice chips. And I needed to start learning how to swallow my own spit. They had dissection, my spit, but only the doctors could do that, and I only saw them once a day in the morning. I had nurses that would come in every few hours and give me pain medicine through the IV. I had to have help going to the bathroom. I couldn't take a shower. I felt gross. I spent about 8 days in the hospital. The day before I got to go home, I had to do a swallow test where I had to drink different textures, different consistencies with contrast, and then they took x-rays as I drank it and swallowed it. And I passed it so that I could go home the next day without the feeding tube. I was so excited. So I got to go home, and in my follow-up appointments, I have continued to lose weight. I can't gain weight no matter what. I'm eating as much as I can, but I have to learn how to chew all over again, because my tongue is screwed to my gums in the bottom of my mouth. I can't move it. I don't have bottom teeth to chew with, and if I did, there would be a possibility I would bite my tongue and not know it. So basically, I have to chew on my plate, cut everything up so small, and then I have to take my finger with little bits of food and shove it in the back of my mouth. On this side, I have a little bit of my tongue left because I took almost all of my tongue. But this side, I have a little bit left with some taste buds. So if I take the food and put it back there, I really can push it, like taste it, and then I can grab it with my throat muscles and swallow it. My doctors had told me I was probably going to have a life of soft foods, liquids. No, I'm not going to live like that. So every day I'm trying something new. I've mastered pancakes. I can do waffles. I have done chicken wings. I have done pizza. And last night I did tacos. All things my doctor said I probably would never be able to eat again. So for those of you that are fighting this and have similar issues with, having the gastrectomy, you can do it. And you have to put your mind to it because you can do it. Your doctors tell you, no, you can't get me on applesauce, yogurt, blended foods. No. Chew on your plate, little bit, and then just make sure that there's somebody with you because it is very easy to choke. I have no feeling in my mouth. I can't tell if there's food in there. So I could put food in there, think I'd swallowed it, and then a few minutes later, be talking, and as I'm talking, the food flies out of my mouth. Talking is another thing. I can't use my tongue to form words like I used to. I'm having to learn how to manipulate my mouth to be able to talk better. But I have come from having to use a dry erase board or an app on my phone to actually being able to somewhat communicate better. Never gonna have the same ability to talk that I had before, but I look at it this way. They got all the cancer out, okay? I survived the surgery where they took almost all of my tongue out. They took all my teeth out. They had to rebuild the floor of my mouth. They sliced my neck from ear to ear. They sliced my leg from hip to knee. I survived all that, and I'm gonna live. And there's so many people out there that don't get the same kind of prognosis as I got. And I will gladly trade all of this because I know I'm gonna be okay. Upcoming, I'm gonna be starting chemotherapy and radiation. Radiation will be every day. Chemotherapy will be once a week. But before that, because I can't keep weight on, I have to get a feeding tube put back in this coming Friday. I'm down to about 109 pounds. I don't even think I weighed 109 pounds in high school. And then I would have to get food for my mask for radiation, but they're trying to see if they can get the lymphedema to go down a little bit more before they put the mask on. And then I will start my radiation. I have no idea what I'm in for. And because I don't know what I'm in for, I know there's other people out there that will be walking in my shoes or are walking in my shoes or know somebody and are supporting somebody. So I want you to walk with me. I will give updates. I don't know if it'll be daily or weekly. But as all of this starts, I will give updates, and hopefully anybody that's going through this as well can help me, and I'll help you. Come follow me. Thank you.